Hey everybody, this is Jerome and welcome back to All the King Sources. Now it's been a while because I made a promise to myself I wouldn't come back until I was in therapy. And I'm proud to say that I am in therapy and on a new medication. So if I seem a little fuzzy, it's, well, because I am. But it got me to thinking about the first therapy session, and that's what I want to talk to you about today. Talk to you about today. See? Fuzzy, but better off. Now, your first therapy appointment can be very stressful, and you have to start off with step one. Step one is very simply, you have to make the appointment. Now, that sounds pretty basic, like most people should know that. But making that first appointment can be really stressful, especially if you don't have insurance. Then you have to go through clinics, and different clinics and nonprofits is a living hell to try and get an appointment. I've tried it. It can take months. But if you are so fortunate enough to have insurance, and it's sad that it's now fortunate enough to have insurance, but that's just the way the world is, then you have to go through the entire list of all the doctors, find out who takes your insurance, and then see if they're accepting patients, because not all doctors are accepting patients all the time. Their caseload gets too big. And then you have to do the hardest part. You have to make the phone call. Now, with my depression and my anxiety, like Wonder Twins power combined, that just makes a huge roadblock. Thankfully, my therapist was, I don't know if she did it on purpose, but was kind enough to make it all online. So I just went to the website for the doctor and I filled out everything and sent it off, and I got the appointment, and it was so much easier than having to sit on the phone waiting for them to pick up, what am I going to say, what am I going to say, what am I going to say? I'm a person and problems, have help, please. That's what I envisioned myself saying. And it's tough to make that first appointment, but it's the first step you need to do. Now comes the actual initial therapy session itself, which is its own layer of uncomfortable at times. Think of it as a blind date that someone just set you up on, and this is the first time you're meeting. That's pretty much what it is. It's two people in a room deciding if this is going to work. And you ask questions, they ask questions, you bounce back and forth, and you figure out, maybe they're not a good fit. And that is completely okay to say, I don't think this is going to work. But hear them out. Because your first initial reaction might be, nope, don't like you, no, I'm gone, bye, and run out. Because it's uncomfortable, and you don't want to talk about yourself. I hate talking about myself, which is why there are so few videos on here. Because I don't view myself as someone that important. And that's just the way my disorder tricks me at times. But you have to sit there, and the thing that always gets me is the first question is almost always, well, what brings you here? I usually make a joke and say the bus, just so I can have some time to kind of formulate what I should say. Now, the best thing is not to focus on the answers you're going to say. Don't come up with pre-canned answers that you're just going to spit out when the doctor asks the question. Focus on how you feel and communicate that. If she says, or he says, my therapist is a woman, by the way, if they say, well, how do you feel? Most people, their knee-jerk reaction is, fine. I'm fine. I'm just so wonderfully fine right now. But don't. Think about how you feel in daily life. For me, I feel worthless. I feel less than. I feel horrible. Try and find a word for your emotion. And most days, a lot of times, what I feel is nothing. And that's terrifying. It's a scary feeling. And if you can communicate that to your doctor, it will help them find you the right treatment. Or they might recommend another doctor. Now, this is important. That is not a rejection. That is actually a gesture of care. They are saying to you, I'm not the right one to help, my colleague is. But it's real easy to get knocked down if they recommend another doctor over themselves. That's not on you. And then, for me, medication was brought in on the first therapy session, which was kind of tricky because when you have a long psychiatric medical history like me, I was having a hard time remembering everything. Because it was like, all right, I was on that pill, I think it was 95? No, maybe that was 2001. Which doctor was that? Oh, that guy was a jerk. Oh man, I didn't like him. That one was nice. And then you just lose track of everything because it's my brain trying to mess with me, which is kind of its hobby. But if you have a lot of it concrete in your head, you think about what is actually hurting, and you communicate it, then the doctor's there to help. But that first step is getting the appointment. So I'm going to put you on the spot now. Make the appointment. Pause the video. I'll be on the screen. I'll wait. It's the recording. I uploaded it. This is like a while ago. Hi. Make the appointment right now. Or if it's like 2 a.m. when you're watching this, find the doctor. Program the doctor's number into your cell phone right now. I'm going to wait. Or you can pause me. But I'll be on the screen. You do it? Good. I'm proud of you. And if you didn't, there's always tomorrow. And please do it tomorrow. Because this is the first step of a long journey. The first step is getting into that office and telling the truth. They only want to help. And I only want to help you too. Now I'm going to do another video after this about the medication I'm on. As I've said before, I'm never going to say what medication I'm on. Because if it doesn't work for me, I don't want it to keep you from trying it. Because it might be the perfect one for you. And I just want you to get to that doctor. I want you to be happy. Just like I want to be happy. And I'm on that road. Finally. I've been doing this for about a year now, off and on. Okay, let's be honest. I've been doing this for maybe 10 hours. All things considered over the years. But I got some energy now. I did the dishes. That's big. Like I wanted to, and I did them. And I have energy left over to do this. That's what I want you to have. That energy, that spark, that something. I don't know. I'm learning it. And I want you to know about it. I want you to experience it. So make that appointment if you haven't. And if, like I said, if you already did, then I'm proud of you. Well, that's all I got for today. I'm going to be doing another video immediately after this in a different way, just to see if maybe a different camera or a tablet works better for this and saves me some stress and keeps me doing it more regularly. But I'm going to be wearing the same shirt, so don't make fun of me. Actually, you can make fun of me. I make fun of myself. That's what I do. But I'll see you next time. So until then, take care of yourself. And once you're able to, take care of yourself too. That is not even close to right. See, I told you, this medication makes me weird fuzzy right now. And we're going to talk about that in the next one. But take care of yourself. And once you're able to, take care of somebody else too. Now go out and have a good day. I'll see you later.